Good morning, everyone, and welcome to the members of the media, my colleagues at Pediatrics of Northeastern Pennsylvania, and the Pennsylvania chapter of the American Academy of Pediatrics, our family community members, Representative Bridget Kozarowski, and Secretary of Health Allison Beam. My name is Dr. Kate Teig, and I'm the managing partner here at Pediatrics of Northeastern Pennsylvania, and I am currently the Secretary-Treasurer of the chapter of the American Academy of Pediatrics in Pennsylvania. I'm delighted to stand here today to mark this groundbreaking week. The Centers for Disease Control and Prevention has greenlit the approval of the Pfizer vaccine for children between the ages of 5 and 11 years. This is under an emergency use authorization, and it now provides parents the best opportunity to protect their children against COVID-19 infection. I'd like to acknowledge the scientists, physicians, and public health officials who work tirelessly to help study, develop, and distribute this vaccine that has saved countless lives over the last year. This effort has brought us to this exciting moment, a day that pediatricians and families have been anxiously awaiting. We now have a safe vaccine that is almost 91% effective at preventing symptomatic COVID-19 infection in children ages 5 to 11 years. As a pediatrician with over 20 years of clinical experience, I am well versed in all aspects of vaccines. Since approval, my practice has vaccinated thousands of children ages 12 and older, and we have witnessed the success and safety of this vaccination. I am confident that the Pfizer vaccine for ages 5 to 11 will yield similar results, helping to protect children from hospitalization and serious illnesses, including MIS-C, a rare post-COVID inflammatory condition that has affected over 5,000 children in the United States thus far. But confidence that matters most for us today is yours, not only in the vaccine, but in us as pediatricians. Pediatricians in Pennsylvania work every day focused on the physical and mental health of our patients. We are privileged to care for your children and recognize the responsibility entrusted to us. Every recommendation a pediatrician makes is centered on the impact it will have on your children's health and well-being. Do the benefits outweigh the risks? At this moment, with the Delta variant still raging and 24% of daily COVID cases in the United States occurring in children, the risk of inaction is too great. I stand with each of my colleagues here and across the Commonwealth and ask for your continued trust as we encourage you to vaccinate your children ages 5 and older. Please recognize that many of us are parents too. We know the fear and worry parents face every day as you make informed, thoughtful decisions about the health of your children. The confidence I have in the COVID-19 vaccine is such that all 3 of my children have been vaccinated, including my youngest child, a first grader, who received his first dose yesterday. For nearly 2 years, we have witnessed the impact COVID-19 has had on children, physically, developmentally, and emotionally. We now have this important tool to help protect children against COVID-19 and enable them and their parents to focus on the parts of their lives that have been negatively impacted from this virus. The vaccine will provide all of us a chance to safely keep our kids in school, reestablish play dates, sporting events, art shows, and other activities that may have been placed on hold during the pandemic. We can visit with relatives safely, including those who are older and immunosuppressed. It really is an exciting milestone. Our practice is about to embark today on COVID vaccine clinics, and over the next 7 days, we are happy to say we have over 600 patients already scheduled for immunizations. Pediatricians across the Commonwealth are available to provide vaccines to children and available to discuss any questions that you may have regarding this product. Your children are your most valuable possession, and we treasure that partnership every day. It's now my pleasure to introduce Secretary Allison Beam, who's joined us to help celebrate this occasion. Thank you, Secretary Beam.
Wonderful. Good morning. What a day to be here. Thank you so much for the opportunity to join you, Dr. Teig, Dr. Troy, Representative Kozarowski, and all of those from the American Academy of Pediatrics. It truly feels like a day of celebration. You have been true partners and advocates for ensuring that more children have the opportunity to get vaccinated and protected against COVID-19. Thank you also to local parent Jennifer Kapp, who was among the first to get her child vaccinated here with the Pfizer pediatric vaccine for ages 5 to 11. Pennsylvania is incredibly proud of the progress that we have made to protect ourselves from COVID-19. To date, we have administered 13 million doses of the COVID-19 vaccine, fully vaccinating nearly 6.5 million residents. Until this week, only those that were ages 12 and older were able to get vaccinated. Today, we are extremely excited to announce that children ages 5 to 11 are also eligible to be vaccinated against COVID-19. This is great news for parents, for teachers, for pediatricians, and community members everywhere. This vaccine means that we now have a safe and effective way to protect more of our children from COVID-19 related illness. Like the Pfizer vaccine for those 12 and older, the COVID-19 vaccine for those 5 through 11 is administered as a 2-dose series, with the second dose coming at least 3 weeks after that first dose. A dose of the Pfizer vaccine for 5 to 11-year-olds contains 1/3 of the amount of active ingredient compared to the doses for those 12 and older. The CDC and the FDA have thoroughly evaluated the evidence regarding pediatric vaccine and found it to be safe and highly effective at protecting children against COVID-19 related illness, hospitalization, and death. If you have any questions about the vaccine and its safety or its efficacy, we really encourage you to speak with your child's pediatrician. So how can you get your child vaccinated as soon as possible? The Department of Health is continuing to work with pediatricians and other vaccine providers across the Commonwealth to help ensure that vaccine is available in every community. With parental consent, those ages 5 to 11 may now receive the Pfizer COVID-19 vaccine at a pediatrician's office, a health center, pharmacy, or other trusted healthcare provider who has the pediatric vaccine. You can find the COVID-19 vaccine provider near you online at vaccines.gov. In addition, many healthcare providers, schools, and community organizations are planning local vaccine clinics to allow children to receive the vaccine at convenient locations and convenient times over the coming weeks. Vaccine shipments from the federal government continue to ramp up, including into next week. So while vaccine appointments may not always be immediately available, supply of the Pfizer pediatric vaccine is not expected to be of a concern. In fact, vaccine providers in Pennsylvania, excluding Philadelphia, will have more than 414,000 doses on hand by the end of this week. Next week, the CDC will be ramping up the pediatric vaccine distribution even further. The COVID-19 vaccination for children's ages 5 to 11 is a big step towards moving through this pandemic. The vaccine will allow parents to feel safer sending their children to school or to visit grandparents. It will allow teachers to feel safer when teaching, and it will help our children, our families, and our communities stay healthy and protected. We're going to continue to encourage all Pennsylvanians to get their COVID vaccine, and we're very excited now that we can include children in that effort. To fellow parents, I say, if you have a child between 5 and 11, get them vaccinated and give your child the power to safely learn and play and be a kid. Thank you so much. And now it is my humbling honor to hand it over to Representative Kozarowski, who has served as a fellow colleague on the Legislative Vaccine Task Force for the last 10 months at this point, which has been a tireless effort to make sure that this vaccination effort in the Commonwealth is as successful as it has been. And so thank you so much. Representative?
Good morning, everyone, and thank you to Secretary of Health, Allison Beam. When she says 10 months on the vaccine task force, it feels like we've been serving for 10 years. But we've made an enormous amount of progress here in Pennsylvania. And today I am thrilled to be here with my friends, Dr. Kate Teig, Dr. April Troy, my neighbor and friend, Jennifer Kapp, women and mothers who are so adamantly excited that we now have this vaccine for our 5 to 11-year-olds. And we're going to be able to vaccinate them. Dr. Teig mentioned the clinics that she's going to be able to do here, and the numbers of children that we are going to be able to vaccinate here is exciting, because we all know the toll that this COVID-19 virus has taken upon our children. We talked about their emotional toll. We talked about the toll that it's taken. They're not in school, they're not with their friends, they're not able to see their loved ones. So being able to start this vaccine process for these children is extraordinarily exciting. We're thrilled to be able to do it. I'm thrilled to have you here in our district as the state representative here in Dixon City. But I stand here really truly as a mother, as a nurse, as a legislator, and amongst my friends here, that this vaccine is safe. It's extraordinarily going to be accessible. I mean, the Secretary of Health, Allison Beam, and I, we did have to struggle very much with distribution in the beginning of this vaccine. We do not have to struggle with that. This vaccine will be available to children. Your pediatricians will be able to answer questions. Of course, there's going to be hesitancy, and I think that this is one of the greatest places to come and be able to get that vaccine safely and ask questions to make you feel safe, that your children are going to be able to go through the winter, and we are going to be able to get a hold of this virus and let these children have normal existence in their schools and their sports and with their friends. So welcome everybody today. I'm thrilled to be here, and I'm going to now hand it off to another friend of mine, Dr. April Troy, who will also say a few words. Thank you. Thanks, April.
Thank you, Secretary Beam and Representative Kozarowski, for the warm welcome. On behalf of my colleagues, we'd like to extend our thanks to Secretary Beam, Representative Kozarowski, the entire team from the Department of Health, and the Pennsylvania chapter of the American Academy of Pediatrics. All have done a fantastic job at mapping out the vaccine rollout and supporting key stakeholders, such as providers like myself and families. I am happy to be a pediatrician within Pediatrics of Northeastern Pennsylvania, which has been a local leader in vaccinating eligible children and adults against COVID-19. Before we hear from Jennifer Kapp, a parent within our practice, I wanted to reiterate the importance of the medical home where children's vaccinations are concerned. The medical home being a team of healthcare providers that ensures continuity of care. We at Pediatrics of Northeastern Pennsylvania, as well as those in practices, big and small, across the Commonwealth, view our relationship with parents and families as a partnership in which to discuss concerns, isolate strategies, and endeavor to ensure quality health outcomes. Take Jennifer Kapp. Ahead of her children receiving the COVID-19 vaccine, we discussed the options, addressed concerns, and talked about children's medical histories, to which our practice is privy. It was a discussion, a conversation among trusted, respected individuals who maintain the same goal of setting children up for success. I encourage all parents to reach out to their trusted medical homes with any questions they may have about the COVID-19 vaccine for their children. As Dr. Teig mentioned, we're eager to have these conversations. You just need to call us. Now I'm thrilled to introduce Jennifer Kapp, who will comment on her decision to vaccinate her children against COVID-19. Thank you.
I would like to thank Drs. Teig and Troy for inviting me to be here today and to speak about my decision as a parent in order to vaccinate my kids. I have 3 children. One is currently ineligible as he's only 4. He'll be 5 in a few weeks, and we will welcome him with his birthday here at the pediatrician's office with his first dose of the vaccination. My 7-year-old daughter, I think, summed it up best when I asked her if she wanted to be vaccinated. And you can see the wheels turning in her head, and she thought about it for a moment, and she said, well, if I get vaccinated and everyone else gets vaccinated, then there'll be no more COVID, right, Mom? And obviously it's a very simplistic view, but yes, there will be no more COVID, and that's what we need to do. And as a parent, we weigh risks all the time. There are inherent risks to everything that we do. I'm an attorney at an insurance company, and I spend my entire life weighing risks and deciding what is good and what is bad and what is a risk worth taking. And I mean, getting in the car and coming here, it's a risk. Sending my kids to school in 2021, that's a risk. But overall, I do understand that my children, they have a low probability of getting really sick from COVID. That doesn't mean I'm not going to vaccinate them. It's for the community as a whole, for the world as a whole, to protect everyone. We want to protect my grandparents. We want to protect everyone's grandparents, to the immunocompromised, to those who are going through treatment. It's our duty as a citizen of the United States, I believe, to protect each other. And so, therefore, we decided to vaccinate. And as Dr. Troy said, I did reach out to her, as I always do. And I asked her nitty-gritty questions as to, there are 2,000 people in the Pfizer study. Is that the right amount of people for a study? And she walked me through anything. There was not a question that did not go unanswered. And I'm very lucky that I am married to a physician. So we sat down and we had a very in-depth conversation about it. And what it comes down to is my husband always asks other providers, what would you do if this was your family? What would you do, Dr. Troy, if these were your children? And Dr. Teig and Dr. Troy both answered that. They already vaccinated their children. They're leading by example. So there was no hesitancy for me to vaccinate my children who were old enough to get vaccinated and to vaccinate my other child. And I'm very thankful for being part of this group at Pediatrics of Northeast PA in order to do so. And thank you.
All right, we'll open it up to any questions at this point.
I have a question for Secretary Beam. Do you foresee a scenario in which the vaccine is mandated for kids to go to school, and if so, when do you think that will happen?
At this time, there's no discussions about mandatory vaccinations, particularly as it's approved on the EUA. And so that's not in the forecast for the near future.
Can you talk about, we've seen the number of cases decline in the last few weeks. I'm wondering what you think about the prognosis for this winter compared to last, because obviously last winter was pretty bad, starting with the holidays. I wonder how you foresee this year going.
Sure. So we're closely monitoring quite a few factors to try and understand what these winter months are going to be. And I think you actually articulated it best in that there's no perfect template to apply to what we're heading into this season. Of course, a differentiator over last year are the vaccines. And so we are going into this winter with a layer of protection and a tool that was only starting to be rolled out in January and December of last year. That is also helpful for some of our biggest vulnerabilities. If you think about our long-term care facilities, our correctional facilities, those are all areas that were of significant concern for some of our largest outbreaks and our largest case counts last winter. And at this stage, we know, at least in our healthcare facilities and our long-term care facilities, we are working tirelessly to not just have residents vaccinated, but staff as well, our correctional facilities as well, and the governor's led on that front. The other aspects, though, are a lot more in our control. There's a lot more travel that folks are embarking upon this winter than there was previously. And we still have in-person school, which is, again, a shift from where we were with hybrid and virtual instruction last year. And so for us, it's a continuous monitoring of all of those factors, cases, hospitalizations, and tragically deaths, but also understanding that this is where we feel there's a lot more of an individual level of control to actually be making sure those case counts continue to decline, making sure folks stay out of the hospitals, the vaccinations, still being cautious with risks, getting boosters if necessary. Those are all more on that individual scale, and we're hoping that individuals take it on themselves to have a more protected winter.
Secretary Beam, two questions. First of
Please.
all, how many children 5 to 11 years old are in that demographic in Pennsylvania?
Hold on for 1 second. I know, Barry, this is one that I'm supposed to have off the top of my head. So right now we have, actually, I don't have it pulled up. Barry will be able to get that for you in just 1 minute. I think we knew what we had previously, but I want to make sure that that's accurate before I tell you.
My more in-depth question would
Please.
be a Kaiser Family Foundation survey of parents shows that 27% of parents are definitely going to get their 5 to 11-year-olds vaccinated. The rest aren't, including 33% who want to take a wait and see approach. What would you want to convey to that wait and see group?
Time is our most precious commodity. One of the aspects of the COVID response broadly has always been that we have been under pressure, and our time under pressure is extended longer the longer it takes us to get folks vaccinated. And so for all of those, and I think there's a multitude of individuals that are eager to get on the other side of this pandemic, the quickest way to do it is to get that vaccination regimen started as soon as possible. And that would be my biggest urgency for folks, is this is how we get out of the pandemic. Dr. Tagg, do you want to speak to it?
Sure. The other thing I would add is that we understand that parents will continue to have questions as they see what happens in their communities and across the Commonwealth and across the country. Parents should feel confident to know that this vaccine continues to be tracked and monitored as any medication or vaccination would be post-administration, and any concerns will be reported to the appropriate federal authority through the CDC, and that has always been transparent and has been since the rollout. So that will be information that we can continue to discuss with them.
I have a question for Dr. Tagg. Would you recommend the vaccine for a kid who has already had COVID?
Yes, that's a great question. And the answer to that is yes. We know that vaccine-induced immunity is much stronger, much longer lasting than natural immunity. So just as it is for adults, if your child has already contracted COVID-19, they should be vaccinated.
And one more question for Secretary Beam. I know you said supply and distribution has not been an issue, but are you worried about hospitals and doctors' offices that are dealing with staffing shortages, if they're not going to be able to handle the influx of patients?
So staffing shortages throughout, again, this winter preparation is front and center for us, making sure that our hospitals have the right level of care to be delivering the right adequate care to anyone who comes through their doors is, of course, top concern. That's with flu, that's with RSV, and the multitude of diseases that already are seasonal. I think ultimately what we've heard from our actual vaccine provider network is that their staff are prepared and ready to be able to shift onto doing vaccination clinics where necessary. And so really limiting factors have been exonerated right now in our vaccination rollout. But of course, we're still making sure that our hospitals can stay open for the proper care to be given to Pennsylvanians too.
Secretary, it sounds like this obviously promote, the vaccinations, but is the state actually going to spend any money on advertising this time, getting kids vaccinated? You do on other vaccinations.
Correct. And we have thus far on some of our consistent messaging on making sure folks even know that the vaccinations are available to them. We've started working on both booster campaigns, but also pediatric campaigns. And so this is in partnership with not just within the administration, but also our Department of Education, making sure that we're able to get to children and to their parents by all means necessary. And so we are investing federal vaccination grant dollars in concentrated media buys, but also campaigns to make sure that social media, even things that go in your backpacks, are going to be able to be available to allow parents to know about the vaccine availability for children.
Do you foresee other types of vaccines being available?
For younger ages? So right now, all indicators point to Pfizer having submitted the right information for a potential approval for younger ages early in 2022. But of course, that has to go through the rigor of the CDC and the FDA, just like all aspects of this rollout have done. And so, of course, we're eager to have more approvals, more people be able to avail themselves of it. But we also know that it takes patience to make sure it's done properly.
What's your answer to the question of when this is going to be over?
Not soon enough. How about that? That's an honest one, right? Any other questions? Great.
Okay.
Thank you all.
Thank you.
He took the clay and he pinched it all around in a circle, and then he put a lot of crazy colors on it and called it a pinch pot. fun about virtual? So one of my nephews had virtual kindergarten too, and he thought it was.
Do you know which arm you're going to get your shot? No? Do you have a preference?
She's a lefty, so.
You're a lefty?
So maybe we'll do it in your right, just in case.
Stand here, sweetie. I'm excited. Are you super excited? I'm super excited for you. You're done. It's all done. Come here. Thumbs up. Awesome. How was it?
Oh my gosh, you are so strong! That's awesome! That's so cool! Congrats!
I don't think I can. I'm so proud of you.